So nice to meet you, everyone. So my name is Yen-Liang Liu. So right now I'm in the program that's a master program of biomedical engineering, but don't worry, I can take a PhD student too. Okay, yeah. So my background, I got my bachelor degree in life science and also master degree in biomedical engineering, both from the National Taiwan University, that's a Taiwan university in Taiwan, and I got my PhD degree in biomedical engineering from University of Texas at Austin. So that's also number one in Texas. Okay, so here is some number about my current status. So in my lifetime, I published 28 papers, and the average impact factor right now that's a 9 point something because this year they announced the new impact factor. I haven't updated this number yet. So the citation number right now that's more than 1,000. So high index that's 16. So my expertise actually that's covered biomaterials and the tissue engineering. I also work on the fluorescence microscope. And currently I focus on the cancer diagnostics and also the cancer treatment. So this is about the stem cell therapy. Okay, so we do the mesenchymal stem cell. We extract this stem cell from the bone marrow. So we expand this cell in the cell factory. Then we differentiate this cell into the chondrocyte. So the chondrocyte is a cell of the cartilage. Then we implement this graft to the defect cartilage. So we can seal this defect with fibrin group. So after 1 year, then we do the follow-up. So this technology actually we start from the bench. Okay, we work on in the lab. I think we initiated this project around 10 years ago when I was a master's student. So I continue work with my mentor, and right now they are able to apply this technology for clinical use. So here is some result from the clinical trial. Okay. So that's a video about the MRI. As you can see here is some defect. So it's clear using the endoscope. So as you can see, that's a damaged cartilage. So once we remove the damaged cartilage, then we put in this chondrocyte graft that's made of a stem cell. Then we seal that with a fibrin glue. So after 5 minutes, it's sealed. Then we finish the surgery. So through this treatment, then we are able to repair the cartilage defect. So I think here is more clear. As you can see, this is a regenerated cartilage. So it turned into a very smooth surface. We can get a biopsy, take a look at that. So as you can see here, that's regenerated cartilage. All the purple spot, they are cell nucleus. So as you can see, make a comparison, that's before and after. So we also use a microfluidic device to generate the scaffold. So as you can see here, we grow different type of cell in this scaffold. Although they have same structure for this scaffold, but different cell actually they kind of come up with different cell morphology. Okay. And in the middle, that's a fluorescence imaging for the 2-photon microscope. So actually, we are able to visualize the bloodstream in the brain using the 2-photon microscope. And this part actually is about the single particle tracking. So we monitor the movement of the fluorescence particle and to see how it interacts with the cell membrane. So this video shows here there's a more layer of the cell. So we put a nanoparticle on the top of cell. Then we look at this particle, how it rotates on the plasma membrane and how it interacts with the transmembrane protein. And currently, we also work on the precision oncology. So we get the biopsy from the patients. So we grow this cell into the organoid. It's called a tumor-derived organoid. So this organoid is like a platform to do the drug screening for the specific tissue because this organoid actually that's derived from the patient. Then we are able to do the drug test to find out which drug actually work the best to cure this lung cancer. And we also work on the biomaterial-assisted immunotherapy. So before we use a biomaterial for tissue regeneration, but for this project, we use a material serve as a cell carrier. So we are able to carry the immune cell and the other drugs for topical treatment. So maybe use this schematic as an example. So we can inject this material together with drug and the cell for lung cancer treatment. So I just like to briefly introduce the working environment at CMU. So as you can see, we have a lot of new facility, either that's just completed in the past 2 years or it's under construction. So the entire campus actually is very dynamic. So as you can see here, the bench, that's a kind of pretty new because we just moved in 2 years ago. And here, that's a cell culture room. And we also have many equipment, so just nearby. So that's very convenient for biological research. So as you can see, we have some flow cytometry, plate reader, imaging system, and even like a site of the Hyperion. So in Taiwan, we only have 2 sets of this system, and it's worth more than 1.5 million US dollar. Wow. So in my group, I also collaborated with many international scholars. Okay, I keep my collaboration with my mentors at UT Austin. So I work with Dr. Yankelov, Dr. Dang, and Dr. Ye. I also have friends at the University of Washington and UT Health at San Antonio. And recently, I tried to initiate a new collaboration with Dr. Sandra at the IIT Madras. So he is in the Department of Engineering Design. So he is an expert of Biomedical system. So after all the research-related topic, I think when I run the research group, it's more like a research family. So I like to use this imaging, okay, to explain that. So that's Jeff Wang at Johns Hopkins University. So he is my research grandpa because he is my PhD advisor's advisor. So that's my PhD advisor, and that's me. And currently, I also have my own student and the research assistant in my group. So it's more like a 4th generation in Taiwan. So sometimes we hang out together or have the meal together. It's more like a research family. So at the end, if you are interested in CMU or in my research, please feel free to send me an email. So I will do my best to respond to your email. And we are looking for the student with interdisciplinary background. For example, biology, biochemistry, or like engineering, or even biophysics. Okay, and I think that's the end of my presentation. Thank you.